Hello everyone, I'm happy to be with you for a few minutes in order to talk about the transition of care from childhood to adulthood in patients with Dravet syndrome. I'm Rima Nabbout. I work in Paris, where I coordinate the reference center for rare epilepsies at Necker Hospital in France. So I just want to emphasize that when we talk about transition, it's all what we are preparing during years of pediatric care, often from the age of 12, 13 years with the patients and the family to prepare the transfer. And it's the time when the patient will go into the adult, I would say, care or into the adult clinic. You would agree with me that the first step of a good transition in each disease, but mainly in diseases like Dravet syndrome, is the best knowledge about the disease, about its diagnosis, its causes, about the difference or the evolution of the symptoms and the different problems that can be different across the ages. And I will concentrate on the transition from childhood to adulthood, but there is also much to do in other transitions, like, for instance, from adulthood into an advanced age. So if we discuss about transition, what we should care about, what we should manage and what we should prepare, definitely the seizure management. Knowing that in many instances with advanced age, seizures becomes more nocturnal and presenting different, I would say, issues and different problems, although the long-lasting seizures will be less important. The other point around the seizures is the anti-seizure medications and polytherapies, where it's here important to understand the therapies that are not classical and used in many other epilepsy syndromes. Definitely, with the adolescents arriving and the young adulthood arriving, the cognition disorders and the learning disabilities become in front of the problematic of the children, especially those that will present less seizures. But let us do not forget about the important problem of psychiatric and behavior disorders that should be transferred, or where we should do a clear transition to doctors and physicians that can deal with this in adulthood. And maybe I will end with, again, another group of problems, the motor and orthopedic disorders that, as you know, will appear at this age and will necessitate a specific rehabilitation, but also specific specialists. And let us do not forget about nutrition disorders, especially in patients with some autism spectrum disorder features, where this problem can continue during adolescence and in some instances even increase. So every need, every system should be evaluated, and we should prepare this transfer not only from a pediatrologist who was coordinating the whole to an adult neurologist or epileptologist who is not clearly in this multidisciplinary approach, but we should really do this transfer in the best way and prepare it for all the aspects of the disease. And I would not say more about the lack of autonomy and need for daily life assistance in a patient that is waiting more. Let's go to very practical problems that is more difficult to control with parents that have the right to be tired and to be aging also. So if we go quickly in some of these barriers for a for a successful transition. From the patient and the family, there is some reluctancy to change a team that was working with them since very difficult and long years. For them, and sometimes for the pediatrician, their child remains a child as he has this disease with some intellectual disability. And there is always this fear of new faces and new places when you move to the adult care. For the pediatricians, definitely they are attached to the families. But in some instances, they have some worries about how the adult services are prepared. And this is where adult care might be really less prepared, but this is our work to empower them and to do this through the clinical training of adult neurologists and epileptologists to be able to understand more about these specific pediatric syndromes, including Dravet syndrome, and the specificity of their therapy. And this is where the education and empowerment of all might be a good message for the transition. So what can we say about the best way to do the transition? Definitely to care about the needs and to take time for this transition. To build a program that is consistent with the availability, with the possibilities of the groups that are dealing with this transition, to communicate between pediatric adult neurologist and the family, to have a dedicated person in each team can be very helpful, as well as having tools that are important as the transition summary, and finally empower adult neurologists, but also and mainly patients and family can be a very important step. Thank you very much, and I hope that this discussion on transition can be helpful for you to understand this issue and how to prepare it. Thank you very much.